Hi guys, welcome to Shine with NJOKI KAMANJA. Thank you so much because you pressed play, meaning you're in the right place. So today, it's a serious matter. I have my glasses, I have my notebook because we are about to go into lessons. When I'm with Daktari, I'm always here to be so keen about what we are going to learn about. And thank you so much for all of you who have been giving feedback about what you have learned on the previous episodes. So today we are going to be continuing with the series that we have been talking about complications during and after pregnancy. Thank you so much. Stay tuned as we connect with our Daktari.
Shine with NJOKI, Kamanja Kathy.
Yeah, hi everyone. My name is John Kibe, and I'm always happy to be here with you. And disseminating this information to you is always a pleasure.
Wow, thank you so much. So today we are talking about postpartum depression.
Yeah.
When I was at home doing my research, I was asking myself how many people had this condition and they didn't know. Because I think I have talked to some people and they had it but they didn't know, but after hearing about what it is and they are like, oh, hiyo kitu nilikuwa nayo. So would you describe postpartum depression?
Thank you so much, NJOKI.
Yeah.
Postpartum depression is a condition that really affects very many women.
Yeah.
Around 1 in 1,000 women are affected. And you know, when you say 1 in 1,000 women, we have so many deliveries in Kenya. So that is a very substantial number of people. Yeah, so postpartum depression really affects women immediately after delivery. And it takes up to 1 year. But it mostly occurs between the first month and the third month. You'll agree with me that when a baby is born, the expected outcome is that the mother will be very happy, they will be rejoicing, and the mother will be all rosy. But this is not usually the case. There's other women who go through troubled time. And the major problem that they undergo is depression. Yes.
Okay. When we talk about postpartum depression, I hear people saying about postpartum blues. What about that?
Postpartum blues is not as serious as postpartum depression. It is just caused by the hormonal changes, because you realize that so many hormones are in play when a woman is pregnant. But when they now start normalizing and then going back to their original state, there is some emotional imbalance, and that may cause postpartum blues. That is expected that a woman can be able to deal with, and most of the women have experienced it and they have dealt with it. But postpartum depression goes beyond. It causes physical and psychological symptoms. Yes, and that's what we're going to delve into today. Yes.
I have heard you say it has like definite symptoms.
Yes.
Like you can say this is it.
Yes.
But before we go to the symptoms, I believe there are causes.
Yes.
The
number one cause is not known. Most people cannot really pinpoint and say this is the cause. Actually, it is not documented, the main cause. But it's mostly associated with the hormonal changes. So that is the major cause, the hormonal changes. But up and above that, there are other causes that are non-hormonal. And number one is the body change. You see, when a mother gives birth, of course, they develop the baby fat and their physical changes. And mothers really look at themselves in the mirror and they have stretch marks. They have, the skin is not normal, and they really look at themselves and they become depressed. Up and above that, there's also a lot of changes that take place, especially in the social life, because the woman is not able now to go, the mother is not able to go out and socialize with the friends, and the continuity of life has been disrupted. Also work-related disruption, the mother is not also able to continue with her life. So that one also causes emotional imbalance, and that one may cause a lot of depression. Also, when the baby comes, you know, the mother is all alert, yeah, and anxious, and she wants to make sure that the baby is fine. And most of the mothers don't sleep well at night. And during the day they are breastfeeding, during the night they're not sleeping well. And when this sleep builds up, it also causes a lot of emotional imbalance. Yes. Yeah. And also we have the worries. They also have the worries, a lot of worries about the well-being of the baby.
Okay.
Yeah, most of them worry, huyu mtoto atakuwa sawa? Will the baby is sleeping, will this baby wake up? I have heard of stories of babies who have slept and they have not woken up.
Yeah.
Will the baby wake up? Some even wake their babies up to they really want check whether they're okay.
Yeah.
And those anxieties also.
Okay.
Yes.
Are there other causes that you?
Yes. Yeah. So okay, there are also there are most other cases associated with age.
Okay.
Mothers who give birth under the age of 20 have, number one, they have a difficult delivery.
Yeah.
That one may also cause because, and number two, they are not psychologically prepared for that baby. Others, unwanted pregnancy or mixed feelings. So the people who are not sure whether they wanted this pregnancy or not, or others who outright did not want this unplanned pregnancy. When they give birth to this baby, also they become depressed. But above all is when there is a break in the support system. Yeah, you remember in a past episode I talked about partner involvement. Now this is not just about the partner involvement, but also the entire community. When the mother feels that she is not receiving enough support from the significant others, now this one really goes ahead and causes them to be depressed. And they feel like, no, are they not happy that I went through all this trouble? I have given birth to this, so they become stressed. Yeah. Also, another thing to note is that if they had a difficult delivery, maybe they had complications like placenta previa, placenta abruptio, others had an emergency cesarean section, others had prolonged labor that goes for days. When they give birth, they do not recover immediately from the stress of labor.
Okay.
Yes.
Is that all for the causes? Because the reason I'm asking, when you said about age, you talked about like the teenage pregnancies,
yes.
those who are young. Does it also happen to those who have advanced in age?
Yes, it does. There are people who get postpartum depression in their fourth delivery, in their fifth delivery. So age is a factor, but it is not really the only factor. There are so many. That's why we said the main causes are unknown. But these are just the factors that are associated with. Yes.
When you were saying about symptoms, I was asking myself, how many people who got this condition and they didn't know, maybe they just went through it and then they are like, niko sawa. But later on, after hearing about it, they are like, oh, I know this thing, I think I got it. It's only that I didn't know about it. Talk to us about the signs, symptoms.
Okay. You've mentioned a very good thing, that how many people have gone through this and they didn't know. I can assure you, the greater percentage of people have gone through these symptoms and they have not known. And the worst of it all is that even the people who surround them judge them. And they think that this person has really changed. I went there to visit, the person did not even want to see us. You see, and they are judged. So many people who have not really heard about it, they really suffer and they don't even seek medical attention. The good thing is that they go through it and they come out of it without knowing that they were in it. But it is a very common thing. Now, for you, that's why it's very important for you to recognize the signs, because it's after you've recognized the sign that you'll seek for help. Because you start from unknown to known. So it's important that you first of all know so that you can seek medical help. So for you to know that a person is depressed, the number one, or a mother, for you to know that you are depressed, is that you feel sad for no apparent reason.
Yeah.
Nothing has made you sad. Everything is in place, but you're still feeling sad. And a sense of emptiness, sense of hopelessness, where you do not know, you're like in a bubble.
Yeah.
You don't know, you don't want to be associate yourself with anything, you just want to be alone. So that's a major cause. But above that, there's also the issue of restlessness. You feel there is not something that is not right, but you cannot pinpoint and say this is the issue. So that is a sign. Also moodiness. Yeah, you so irritated. Any time you're irritated, nothing makes you happy, and the people around you, it's so difficult for them to support you because they don't know exactly what you want. They have provided everything that you need, but they are feeling that you are still irritated, and a slight thing, even the other siblings, maybe if this is not the firstborn, you don't want them near you, you just want them to be away. They irritate you, and you look at them, you're irritated. You look at your husband, you're irritated. Your mother-in-law, everyone around you irritates you. Yeah, so that is a very major reason. Yeah, there are other people that give birth and they cry non-stop. Every time they are tearing. Hey, mama, what is wrong? They're just crying for no apparent reason. There is a certain form of sadness that engulfs you, and you do not know the reason, but you just feel like crying every time. And I know there are women who can associate with this.
Does it happen, that one of crying, before you get the kid? Because there are people when they are praying, they say, "Mimi nasikia tu kulia, wacheni nilie."
You remember I said the major cause is hormonal. Hormones play a very major role in your emotional well-being and stability. So when they're imbalanced, they also affect even your the way you feel, the way you express yourself. You remember, even for you to be happy, it is a surge of hormones that is produced for you to be happy. Yes. So when a hormone that is responsible for you to be sad is produced increasingly, then you become sad for no apparent reason. Yeah, but there's something else I want to mention. There's also the sign, as another sign of sudden rage, sudden anger. You are laughing, everybody was happy with you. All of a sudden, it's like a switch. Sudden rage. Every word that everyone speaks irritates you. So that's another major reason.
Are there other symptoms?
Yes. We also have what we call physical symptoms. Yes, and this will surprise you. We have what we call psychosomatic disorders. This is a psychological symptom that makes you experience physical symptom. For example, you may have back pain, abdominal pain, and severe headache or migraines. These ones are just psychosomatic. Even if you are taken to the laboratory, nothing will be found. Your kidneys are okay, your blood pressure is okay, your HB is okay, but the body can cause, the mind can cause your body to experience physical symptoms. Yes. So those are major. So once this person is taken through the medical process, and you realize that in addition to the other symptoms, there is no immediate correlation with why they are feeling these symptoms, then you know if you treat or you are able to give psychosocial care, then the physical symptoms will also subside. Wow.
I didn't know about migraines.
Also there is also the issue of some people when they are depressed, they either eat so little or eat so much. So they have this sudden urge, they want to eat chocolate or sugary things, or others don't want totally to eat. Yes.
Okay. Are there others before we go now to the diagnosis?
Maybe I would mention only one more. There is also the difficult with forming attachment, emotional attachment
Okay.
with the little baby. Yes. So the mother does not want to really take care of the baby, anawapatia kaini na mtoto.
Kaini,
So they don't want to form emotional attachment with the baby
Yeah.
and with the husband and with the significant others.
Okay.
Yes, definitely.
Now, talk to us about the diagnosis.
Okay. So, because it's a psychological issue, the diagnosis is usually talking to them and taking history and asking them targeted questions. So like these questions, do you feel like you don't want to have your baby close to you? Do you feel sad? Do you feel like crying? You see, also when there are also some other conditions that if a mother developed a condition, that condition may cause so much pain that it causes depression. Okay. So if there is a specific complaint that is physical, like I said, they might have psychosomatic disorders, like headache, like so you can check they get taken to the laboratory to check specific systems that are affected by the as she explains. Okay. So if you find any symptom, any laboratory result that is out of the range, normal range, then you treat the cause. Okay. Or whatever abnormal results that you will get. Okay. Yes. But mostly the diagnosis is psychosocial. You sit with the person and get the diagnosis.
When we talk about, let me digress a little.
Yes.
I believe if there is a husband or the man going through this journey with this woman, do they also experience this postpartum depression? Because for them it's more emotional than hormonal.
Yeah, husbands too may experience this, but you realize that there are no hormonal changes in men. Yeah. Most probably, maybe what may have happened is that there might be some difficulty in coping with changes. Because now the baby has come, the bed is no longer enough for the two of you. Yeah, the mother is here. She does not want to see you. Yeah. She is sad every time. And then there is also the attachment that is deprived from the husband, given to the baby. And so there might be some emotional instability for the man, but it cannot really get to the level of a mother.
Has there been a case where a man, after going through this emotional stress, the reason I'm insisting on the men is because I feel like we feel this journey is only for the women, but even one counselor once told me, when you're pregnant, your husband is also pregnant, only that their belly is not protruding because they are going through this journey with you. So I'm asking, has there been a case where maybe they have come to you and the man also has been going through these things, and how do you help them?
Okay. Now, one challenging thing with men, I don't know if it is because of the way we've been brought up, the social expectations that a man should be strong, a man lazima ajikaze.
Masculinity.
The masculinity crisis. Men really do not express these things outright. So wanakufa kifo cha kikondoo. So it's so rare for you to find a man coming to you and saying, my wife got a baby, now I am depressed. Yeah, I know those cases are there if we were to look keenly, but I would lie if I would say I've ever encountered a man who has come for help because of such. But I would say also it depends with the coping mechanism of the man. If a man is able to cope with the changes that happen, and adjust and realize that this is not permanent, then them that have emotional intelligence are able to really cope very fast with the changes that are around in the house. But for them that are not able, maybe that distance may really be big, and if a man realizes that this is happening, it is important that maybe they seek psychosocial support.
Okay.
Yeah.
Let's talk about treatment.
Yes.
Yeah.
Now, you realize that also it's a psychological issue. Most of it recovers through psychosocial counseling. A lot of counseling and counseling sessions, and walking a journey with a counselor. Really, when women, a mother is given opportunity to express themselves and to speak about their fear, and also the people who are around them are even made aware of what the mother is going through, and they are told on how to deal with this case and how to support the mother. Eventually it resolves. But this is not usually the case. Sometimes it might really go beyond what psychosocial support can help, and therefore that is a point where we now give drugs. We can give antidepressants. We can give those are drugs that really help to reduce the hormones that are causing the depression. We can also give what we call mood stabilizers, and some actually it goes beyond psychological depression and it goes and becomes a psychotic issue. We also give them antipsychotic medication. For some, it may be too much that drugs are not even able to help. Then we have a procedure that is done that is called electroconvulsive therapy, is ECT. That is a slight voltage of electricity or current is passed through the brain. Na inafanya ni kama reset button. Reset button. It's a dangerous procedure, so you have to sign the consent for it. But it is only done in extreme cases where drugs and social counseling are not, psychological counseling are not working. Yes.
When you said about now when it is at the extreme, I thought about what I wanted us also to talk about. Puerperal psychosis.
Yes.
I was seeing in my statistics that it affects 1 to 2 in 1,000 mothers who give birth. Talk to us about puerperal psychosis.
Okay, when you say puerperal, this might be confusing to many. I don't know where you've gotten these terms all of a sudden.
I'm telling you.
But I would want us to bring it back home.
Please watch me before I start a clinic.
Yes. So when you say puerperal, you mean postpartum. It's just one and the same thing. It's only that you want to sound more clever.
Of course.
So postpartum psychosis is an extreme level of postpartum depression. Now it stops being depression and you develop psychotic tendencies. Psychotic tendency is where now you are no longer in control of what you think, what you feel, your senses. You are no longer in charge of them. There are other forces beyond you that are now taking over. This is where now you start experiencing signs like delusions. Unakuwa wazimu. So and this viewers might really have heard about it, that a person alijifungua, then the person became mad, kaenda kaanza kuokota makaratasi. So this is psychotic. This is no longer depression. And it presents in very many ways, not just one way. One person may be delusional, where they feel like they are very important than the way they are. Mtu anaweza simama mahali aanze kujiona yeye ni president, and they believe that they are president, or they believe they are Mother Teresa, or a very important person in the society, and you cannot convince them otherwise, because their system believes that, and they act in a manner likely to suggest that they are that. The other thing is they start hallucinating. Hallucination is where they hear voices, they directing them, and it's dangerous because these voices may tell them to, and it is a medical emergency. Medical emergency in the sense that this person is a danger to themselves, and is a danger to the baby, and a danger to the surrounding. This is a person who can hear voices to harm the baby, and they can dangle them on the walls, on the fourth floor. So they are supposed to really be taken care of
as an emergency.
So these are what we call hallucination. They hear voices telling them to harm themselves, telling them to harm the baby, telling them to harm other people. They can speak to those voices, those hallucinations. They can feel tactile hallucinations where they feel like there are things that are touching them.
That's why they do.
Yeah, they feel like there are flies or things are walking around them. Yeah, they want to and test. You see them wanaweza sikia kuna test kwa mdomo mbaya, wanashinda wakitema mate. You know, and it's so real for them. Some are very irrational. They're not irrational in the way they argue their things. When they talk, you cannot understand them. They are speaking of 5 things at once, 5 different things. And others are not even able to communicate totally. When they try to communicate, they speak a language of their own. If you try to get what they are saying, it is not a language that is documented. It's only in their mind. Yeah, others are hyperactive. They have a lot of hyperactivity. Yeah. Unaweza pata mtu ametoka hapa ameenda ametembea mpaka Roiro. Yeah. Usiku ako kwa barabara kando peke yake. And some don't eat. So even their health is really affected because they don't eat. Yeah. They are not aware of themselves, wanajiendea choo na kila kitu. So these are pure psychotic. They have mood swings, and they also have, as I said, difficulty in communication.
Now, after we have heard about how it is, what is psychosis, how long after birth can one get this issue? After giving birth?
After giving birth, we said it can be immediately after giving birth. And even if it does not happen that time, it can happen even within the 1 year, 12 months after.
Okay.
Yes.
What?
But I said mostly it happens between birth, immediately after birth, and 3 months.
Okay.
Those are the cases that have been documented mostly happen during that time. Yes.
Okay. Now the difference, if I get the difference, is that the psychosis is extreme.
Yes.
These people who are around this person, apart from handling it as an emergency, going to the hospital, after this person is gone and they have the baby, how do they handle that situation? Because I believe the baby has to continue breastfeeding.
Yes.
Or do you cut the whole thing?
Yeah, so that is an aspect of care that mothers and the people who are around need to be trained. Number one, we say a baby should breastfeed exclusively for the first 6 months. But now this mother is not even able to express milk. The mother is not able to give milk. The mother is not eating properly, so therefore when developing lactation might have a problem. So we advise that the baby is given milk supplementation.
Okay.
Yes, formula milk. That is the one that is closest to the mother. Nothing can be compared to the mother's milk, but that is the one that is closest. It has been formulated to be palatable to the baby and also not to affect the gut, because the gut or the digestive system of the baby is not fully developed. So wengine wanaenda, they say changanya maziwa na maji kidogo. That is actually out of what we advise. Okay. Say if the baby is not getting breast milk, let them get formula milk.
Okay.
Yes.
Is it something you treat completely, or you just teach how to manage? How do you go about the treatment?
We said that the treatment is still the same. We give them antipsychotic drugs. They are drugs that have been given to stabilize them. Others recover fully, and we've heard of testimonies of people who have spoken and said that they had this problem and they recovered. But others, unfortunately, when it's very severe, it may become permanent, and they may be put on medication for lifetime, and others may never recover.
Okay.
Yes, yes. So it's all the others recover, others becomes full blown, and they may never recover.
And because you've said that immediately after delivery is when this psychosis can start then.
Yes.
Is it because of maybe extreme laboring, or why are the causes the same as postpartum depression?
The causes are the same, but for psychosis, the major cause is this mother might have had a bipolar condition. Yeah, bipolar is where they have mood swings. It's extreme. They are elated, very happy, and extremely they are jumpy. The next minute they are so depressed. And the people who have had psychotic condition, kama kwa familia pia kuna hiyo issue ya watu wanakuwa na hiyo psychosis, then it might really be a major cause. Yes, yes, yes.
The reason I asked that is because I thought it only comes after depression, and then I heard that it's after birth. Now, if the case is extreme to the extreme, it cannot be treated. Now, do you people tell the people around them, this person, no other babies, or it's up to them to decide?
Now, when it is discovered that the person may not be able to make decision on their own, then we allow the next of kin to make that decision.
Okay.
Yeah, if they are advised that we put them on a family planning, because remember they are vulnerable, their decision making is impaired, and they may continue getting more children without their own intention. So we counsel the relatives, and if the next of kin is agreeable, then we provide our family planning method that the mother is able to adapt consistently. Unajua ukimpatia pills ameze kila siku, it be a problem. So we give a method that is actually able to really work well
with them.
In regards to the condition.
Okay.
Yes.
Thank you so much.
Yeah.
We have learned a lot.
Yeah.
At least now, if we see some signs, we are able to take care of our loved ones.
Sure, sure.
But we pray that it doesn't happen to anyone. That is our prayer at the end of the day.
Sure.
So thank you so much.
Karibu, thank you very much.
Yes. Thank you so much for watching. Remember, you're the light and you can shine. This is Shine with NJOKI KAMANJA Kethi.
Shine with NJOKI KAMANJA Kethi.